So it's time for our question and answer session. We do this every weekend. Thank you to David Ashford, Minister for Health and Social Care, giving up some of his Sunday. We've also already done an interview about just a general catch-up on all sorts of things. Mr. Ashford, a lot of this will be going over old ground in the sense, especially about the borders. So I'm going to read them all out because there might be just little different angles you might want to pick up on, but certainly a lot of people for and against, as you can imagine. So 19th of April, lockdown looks to be ending. We're going to herd immunity rather than elimination. My concern that needs answering is this. My daughter's 13, high risk. Me and my husband are under the medical investigation at the moment, so could be high risk, but we don't know yet when we're going to get it. I'm 38, my husband's 40, neither have been vaccinated yet. It feels as if we're being told to get on with it now, and I, for one, am very worried about this approach. In summary, I suppose my question is, how do we approach work and school knowing that we will be at some point exposed to COVID with no protection? It feels like under 40s, children especially, are being told to just get on with it.
Right, well, the good news, Paul, is with the age groups they've just given, their vaccine letters may well have arrived since they've sent that question into you, because that age group is now being invited forward. I know people are concerned. We're not going for herd immunity. We need to be absolutely clear on that, because herd immunity is still an unproven concept in relation to COVID, and potentially a very dangerous concept because, as we know, people can actually catch COVID multiple times. I have a friend who's actually had COVID 3 times now in the last 12 months. So we've just got to be careful about using phrases like herd immunity. What we're potentially moving to over time is the mitigation strategy, because we have to recognise COVID is not going anywhere. So we can't keep the island locked down for decades on end, potentially, because COVID might be with us forever. But what we have to do is try and protect as much as we can the people in the community. That's what the vaccine programme is doing. And we have to remember that, as with other viruses, it won't always be a pandemic. So over time, case numbers will come down. And at that point, we then need to start treating it like we do any other virus in the community.
Classified buy and sell sites seem to be up and running again. This person says, surely they're not still permitted, are they?
Well, under the current regulations, people should not be going to collect items for sale on those sites, and they shouldn't also be advertising because people can't collect.
Will there be a detailed risk assessment carried out and safety precautions put in place before schools and nurseries are allowed to open? And will there be assessments and procedures be inspected by the Health and Safety at Work Inspectorate?
Yeah, so they're also overseen by Public Health as well. So Public Health has been liaising with the schools. The actual schools themselves and the Department of Education have been working with the schools on what measures they need to put in place. This isn't something new, by the way. The schools have been doing this since the pandemic last year, even in the times where we were operating as normal. I know the schools had risk assessments in place as to what to do if there was an outbreak within the schools. So this isn't something new. This is something that's been in place now for 12 months.
The next is a resident who hasn't got a GP and he's worried about getting vaccinated. He says he's 58 years old, has been a resident here for 4 years, but was struggling to register with the GP practice as he didn't want to register with the local practice. He's keen to be vaccinated, but as things stand, is that possible?
Right, it's possible if he registers with the GP practice as a temporary resident, so that only gives him a short period of registration. Then basically he'll be picked up by the vaccination programme. But also, since his age range has now been reached, he can register online. So he can go online onto the covid19.gov.im/vaccine reg, and he can register on there for his vaccine.
This person says they know that the island has followed the UK in extending the period between vaccines to 12 weeks. However, whilst there appears to be data supporting this for the Oxford vaccine, they were unable to find any research based on evidence that supports this for the Pfizer vaccine. In fact, the CDC states that the second vaccine should be followed up within 6 weeks. This person says they're curious to know what research-based evidence here for the Isle of Man government and what they're basing your decisions on. And as suggested, are you just blindly following Boris?
No, we're not blindly following Boris. I can assure people on that. We've looked at there is actually a study out there that looked at the long-term effects of Pfizer. It's quite a recent study, not that long ago, that actually showed that extending the time with the Pfizer vaccine also does not affect the efficacy of the first dose. Because we've got to remember that was one of the key worries, was if you extended the time too long, did it affect the efficacy? There is now a study which was a preprint in the Lancet as well. So I'm not referring to the previous preprint, which focused purely on Oxford. There is one now for Pfizer as well that shows exactly the same situation. The JCVI as well is a professional independent body. So it is not run by the UK government. It advises independently. And the JCVI also say there is no damage done to extending out to 12 weeks.
When can I look to see relaxation on the rules for isolation once having both vaccinations? I'm now 13 weeks post first vaccination and 10 weeks post second. Realistically, I'm as protected as I'm going to be. I can't be protected anymore. At present, if I need to go to the UK, which has a very low positive case rate, I still have to isolate together with all my family on my return. With UK restrictions being relaxed with non-essential shops reopening, surely this is a good time to move forward and relax border isolation restrictions. I'm aware that having the vaccine does not stop me catching the virus or passing it on, but I must be now a low risk. Can you introduce new pathways for people who have had both vaccinations when a whole family doesn't have to then isolate?
Right, it's not going to be the vaccination that will drive that, because as the person rightly says, although the vaccine has shown encouraging signs of lowering transmission, it doesn't remove transmission. So someone who is vaccinated, the vaccine protects them from becoming seriously ill, but it doesn't prevent them, as the person say, catching it or potentially passing it on to someone else. And that is what we currently need to protect around. Isolation requirements would be looked at as a whole. And obviously, as we start releasing things, isolation requirements will be one of those where it may reduce to 10 days, it may then reduce to 7 days, to 5 days, to eventually isolation requirements being removed in totality. But that is something that would be done as part of the steps for the whole population. It's not something where you would carve it out and say, if you've been vaccinated, you can now do this.
I'm asking for advice from kitchen and bathroom companies. Starting Monday the 12th, I was under the impression we could only have one person per room to work, but a kitchen unit weighs excess of health and safety regulations for moving and fitting. So, for example, fitting a bath on your own upstairs would be impossible. I was hoping someone may be able to advise on the plans to go ahead with this and ensure we're sticking to the return to work guidelines set out.
Well, the guidelines that are set out, we do recognise that there's some tasks that people won't be able to do because of various, like you say, health and safety at work issues. But what it is it's to allow more to be done. We're not expecting that absolutely everything will be able to be done in one go. So people do need to abide by the regulations in terms of the number of people per room, not coming into contact with the household. That will realistically leave some tasks that can't be undertaken, but there is a multitude of tasks that can. And so, again, it's just part of the easing of restrictions. And then in future stages, that will obviously relax further.
I have a motorhome. I'm hoping to go to Spain, which I have to travel through the UK mainland to get to Santander. On my return journey back through the UK to the Isle of Man, we have both had our 2 vaccines, by the way, it says. Do we have to quarantine in the UK in a hotel on arrival back on UK mainland, or can we drive directly to get the boat back to the island and quarantine here on the island on arrival?
Well, my understanding is they can drive directly because Spain is not on one of the red list countries for the UK. So that means that because they're travelling within the common travel area, they can drive directly up to the port. If they were to, say, spend the night in the UK before going onto the boat, then they would have to quarantine for that one night. But my understanding of the rules and regulations in place in the UK is the mandatory quarantine is only for those coming from red list countries or those who have been in red list countries, and I think it's the previous 10 days. For those who are just coming from another country, coming to the Isle of Man, they can onward transit.
One more in this section. A number of people in hospital over the time have been admitted because of COVID, but are now testing negative despite still being very ill as a result of having COVID. And the person was basically saying they're worried about how it's shown on the dashboard, really. How do they, they still count as COVID people?
Well, no, if someone's no longer positive for COVID, they don't show as being a COVID case because they are no risk of infecting someone and they have recovered from the virus. Now, that doesn't mean that the issue with the hospital is we've got to be very careful here, because what you sometimes find is people who are admitted to the hospital have other health conditions. And it may well be the other health condition that is primarily the cause for them being admitted, not necessarily the fact they've got COVID. And so there's a balance. So people may recover from COVID but still be seriously ill from that other health condition. But once they have recovered from COVID, they no longer need to be isolated and their other condition will be treated as normal. It would be completely disingenuous to try and continue to keep those people in the COVID figures because they have effectively recovered from the virus.